Hi everyone, welcome back to the channel again. So another episodes of the Topic Talk. Here we have a guest now, and she is Dr. Sayantani Das. She is secured and ranked 85 in the INICET 2025, and she is my also college senior. So, Didi, welcome to my channel, and thank you so much for giving your consent and of your valuable time. So, first time I'd like to ask that, কেমন আছো?
ভালো আছি, তুই কেমন আছিস?
চলছে রে, প্রপ আসছে তো। So,
হ্যাঁ,
Didi, I just collected some questions that I asked from my both juniors, my batchmates. So, according to your experience, and I will ask one by one, and you have to answer that according to your experience. So, the
sure.
first question is that, uh, so with your rank, that is 85, obviously as a great rank, within the 100 among the all India. So with your rank, you could have any top branches like radio diagnosis, but and also the Dharma and also the medicine. So so-called the contemporary top branches, but still you choose to take the MD Psychiatry. Why such a branch that here the results you can see in the months, not in the minutes. So why are you choosing the MD Psychiatry over other branches? What I just want to know your view.
First of all, I have always liked psychiatry as a subject since the very beginning of my uh, not MBBS first year, but around MBBS third year when I got to know the subject first. তো আমার সবসময় পড়তে খুব ভালো লাগতো psychiatry. And mental health was a topic which always used to uh, intrigue me, and I was always curious as to how to, uh, uh, what what are the challenges in mental health and how can you make it better for the people around. And I always believe that whatever is your passion, whether it is a major subject, so-called major subject, minor subject, it does not really matter. You should follow your passion because যেটাতে তুই ভালো যেটাকে তুই ভালোবাসবি সেটাতেই তুই বেস্ট করতে পারবি. That is what I believe in, and that is the reason for me taking up psychiatry.
One thing that I want to add that though I have not come across to an internship psychiatry duties, but I selected the elective. There's an elective subject of the 15 days
Yes,
at the start of the final year. I also
yes,
chose the
yeah.
psychiatry. So
Oh,
there I saw that
great.
their complaints are little bit different, and also that I used in other subject and also other forms. That
Yes,
there's so much like one asking that I have hallucinating the different type of gods in front of my eyes. I have seen a lot of the cases there, and I was
yes,
just shocked. So it
yes,
was really an interesting subject.
exactly.
Obviously, I just want to know. So
Hmm.
the question is,
Yes,
the next question is also related to this that there is a stigma in our society. Still, there is a stigma, but something have developed students, patients, and also that there is also a branch like mental illness. But still, there is a stigma that pagolet doctor type of. So how you
hmm.
want to change that perception, also the stigma, the narrative as a psychiatrist in upcoming future.
Um, the future of psychiatry looks hopeful because many people are uh, getting out of that stigma, and especially if you look at our OPD, I being coming from Kolkata, I did not expect that in Bakuda we will have so many patients in our OPD coming to the psychiatry OPD every day. And that is what actually shocked me when I was first posted in psychiatry in my internship, that even in such a rural area where people are struggling to meet their daily needs, mental health is still being slowly but steadily becoming a priority. So, um, first step is definitely like me choosing psychiatry also has helped many other people in my family to actually get to know the subject that okay, people do choose psychiatry even after securing good ranks or even when they have a choice of taking up medicine and surgery.
Yeah.
So that has also helped a lot of people understand the subject a little bit better, or at least try to understand the subject. And slowly but steadily, there is change coming in our society. And I also hope to be a part of that change by, first of all, studying the subject obviously in a very good way. and then hoping to spread awareness that the mind and body both are part of the human being, right? What constitutes our human body? The not only the physical body, also the mind that we cannot see, but we can definitely feel. So any disease, if it is related to our body, we are not ashamed to take it up to the doctor. But whenever it comes to the mind, there is a feeling that okay, might be I should not disclose it to everybody because people will think that I am pagal or mad, so called.
Pagod, huh?
So, uh, so that is slowly changing, and hopefully
You
it will change for the
you
better.
said that you shocked that, but actually I'm from Bakuda, but I also shocked that there's a lot of the patients. Even one thing I want to add that there's
Exactly.
one
Yeah.
vendor, there was street vendor that I used to see him from since my childhood. One day I noticed him in my OPD, and he came and
Okay.
told said that sir, I am feeling I'm suffering from depression. আমার খুব depression লাগছে. And I used to think from since childhood, I never thought that such types of the persons there's a they are on the daily worker type. So they
Hmm.
also can suffer from the
Hmm.
depression side. Actually, previously we used to thought that
Exactly.
the mental illness was a higher class disease, but it is
Exactly.
totally
Hmm.
changed.
Hmm. Hmm. And especially depression, anxiety, we used to think that it was like from people of tier 1 cities. But now in
Uh,
Bakuda only OPD, if you see, you will find that depression, not only schizophrenia, things like depression, OCD, there are patients suffering from them even in the utmost lower classes. That is what is
yeah.
surprising.
So now I just want to move to the another portion that you know preparation base. So that how you achieve the 85 is rank 85. So the major studies for the NEET PG, most of the students study for the NEET PG, and but INICET is a different beast, right? So what is the logic based shift that you made in your preparation that pushed you to the in the top 100 across the country? So what are the extra age preparation you did for the INICET rather than the NEET PG, which lead to a top
Look,
100
first,
rank?
hmm, the first thing that I would say is আমাদের কলেজে যেরকম internship coming from a peripheral college, everybody knows that internship is very hectic, especially in West Bengal. It is extremely hectic, one of the most hectic duties you get in internship. So very honestly speaking, internship way I did not get any time to study, and even if I did get any time to study, I did not want to because I was physically and mentally both exhausted because of the heavy duties. So that was not the time that I wanted to study also. But I made sure that throughout my MBBS life, first year, second year, third year, and fourth year, I made all my subjects notes and I studied the books also thoroughly. So at the end of internship, when I started studying for NEET PG and INICT, I had all my notes at my disposal so that I could study from them. So that was already done. And the funny thing is, when I gave May INICT, I had gotten a rank of 23,000. But even worse than that, I think 25,000. So from that, if I can come to this level, I believe that anybody can do this. So first of all, you have to believe that this is not something that only toppers can, or this is not something that somebody who studies all the time can. That's not true at all. If you have the determination and if you have that grit to study, focus and study consistently every day, whatever amount of time you can give, 8 hours, 10 hours, 4 hours, 6 hours, whatever, but make sure it is every day and consistently, then you can definitely achieve this. The difference from NEET PG, I would say, is INICET is very PYT based, rather, previous year topic based. So, right from the start of your preparation, I would suggest that you write down the PYTs that have come in the previous year questions, at least 5 years back, starting from 5 years back. So, after doing that, uh, do those questions and do those topics thoroughly. Definitely thoroughly, you have to do those. After that, definitely the grand tests, you have to give them consistently. I did not get to give much time, but whatever time I got, I think I gave all after NEET PG, I gave I think 4 grand tests. So I would suggest giving more if somebody can, definitely, but that was how I prepared.
So you were saying that only the consistencies can do such results, and also a strong determination, also the dedication.
Yes, definitely. I mean, it does not matter what kind of a student. I mean, many people, the first hurdle to giving INICT, getting a rank in INICT is that, oh my God, INICT is a very difficult exam. There are only very few seats. You need to score top 1,000 or maybe top 500 to get very good, get into very good colleges. But don't let that be a hurdle. If you start studying by thinking that I might not get because there are less seats, then you will not get because you will not have that determination to carry through, right? So stop thinking about those things. Just focus on what the exam wants you to do. The exam wants that you should have a very thorough concept about the PYTs, the topics, not only the previous year questions, the previous year topics that have.
Very good. Thank you so much. Uh, so now, next question is that for the junior who is currently struggling with their grand test, so tell us that how many grand tests you said, the four, I think, and how many grand tests are given, and when did you give your first grand test? I mean, before the NEET PG too.
First grand test I gave, I think after internship only. I did not give it before internship. Before internship, I had only given one grand test, and that was also not counting. I'm not counting that. So after internship, after the first 1 month, I had given my first grand test, and needless to say, it was not a very good score at all. I had barely done, I think, 102, 3 questions right. After that, I gave GTs every month, and before NEET PG, I had given the last month before NEET PG, I had given 2 GTs as far as I can remember. And then from NEET PG to INICT November 2025, I had given 4 more GTs. For all these 4 GTs were of INICT pattern only.
Okay, so before giving two GTs, you used to revise all the notes and also the theories too, right? And also doing MCQs. Okay, so before revise all the
Yes, I used to actually follow this strategy that after giving a GT, I used to try to analyze it either that same day or the next day. I used to sit and analyze it. So, and after analysis, I used to look at my bottom 3 subjects, which I have done very bad. Bottom 3, which are ranking in that GP. And then I used to look at those subjects and write down those topics, whatever I have done wrong. And then I used to study for the next few weeks. I used to study those topics, and major medicine gynae I used to keep as in when revising Uttashatri before giving the next
so,
GT.
okay, thank you, Didi. We got it. So you tell me, us one thing. Tell us the one thing that at least how many MCQs one should practice. At least average number of the MCQs one should practice per day. At least average
Average number of MCQs, right? Okay. So in initially when you are first starting your revision or first starting your reading notes, that is the first read should be a very good read, right? So that is going to take some time. That is going to take around, let's say, 1.5 to 2 months. Definitely, that is going to take. If you have all your notes and with you, it is going to take 2 months around. And during that first reading time, I would suggest doing around 50 MCQs. I used to do that. I mean, Not there is not a specific number that I used to do, but around the target used to be 50 MCQs. Next, second revision onwards, you should focus more on your revisions and more on your MCQs. So then you should ensure that you first start with the previous year questions. So in whatever platform you're using, whether DAMS, Marrow, whatever, you will find a section of previous year questions, right? So make sure in every subject you complete those previous year questions first and then move on to other questions as well, other MCQs as well. And around, let's say, 75 MCQs, 75 to 100. If you can do more, definitely do more. But 75 to 100 is a good number, I feel.
Thank you, Didi. Got it. So now let's come to the another again your career-based question. So why you aiming for NIMHANS rather than AIMS? Why you choose NIMHANS?
I chose NIMHANS because when I researched into this field of psychiatry, I realized that NIMHANS was one of the best, if not the best institute in our country for mental health and related neurosciences. So, and AIMS Delhi, I got equally good feedback. That was also a very good college, excellent campus, excellent faculty. And additional benefit, or rather I would say one good thing about AIMS is that you get to mingle with the other departments as well, because it is a complete, you have medicine, you have other departments, right, gynae, pediatrics. But in NIMHANS, since the focus is completely on neuroscience and psychiatry, I felt like that would be a better fit for me since I'm choosing psychiatry, so why not go into the best institute?
Okay. We want to ask that, and how you used to inspire yourself for মানে, for giving such a really and extraordinary result within the 100, because uh, it is really praiseworthy that scoring rank within the 100 in your first attempt from a peripheral medical college. There's a lot of huge patients load in the internship. So how you used to inspire yourself?
I would say that inspiration, as in when I used to sit down for when I first started my revision and when I first started my preparation, actually, I used to see those topper interviews on YouTube that is there, and every person that I saw there being interviewed, there was a very positive attitude about them. Like in their life also, there have been many setbacks. There have been many GTs in which they could not score as much as they had expected to. But the one thing that is consistent is they did not give up. And they did not give up and they followed a consistent routine. So I also try to incorporate that in my life, that I will uh, sit down every day, not more than 10 hours, but I'll give 10 hours every day. And there are many days where you'll not feel like giving that, but when you have made a routine that I have to do this in my day, and when you make it like for months on end, you will automatically fall into that, that routine, that rigorous routine that you have created yourself. And that is what actually inspired me, because slowly and steadily, when you will follow that routine, you will check off those that, yes, I've done this, yes, I've done that. And slowly and steadily, when you will see an increase in your scores also in those tests, you will yourself get that confidence that, yes, I am only doing great. I'm doing better. If not great, I'm doing better at least. Even a small step forward every day counts, right? Even if I followed DAMS, so I can say that even Deepti ma'am used to say that even if you get one question right, the next GT that you're giving, that is improvement. That is what counts. So that one question, I think we all can focus on, right? So that is what used to inspire me. And don't worry about the results. Like even this increasing competition, in this era of increasing competition, I mean, there will be times when you feel like you have given your best, but the results might not be that. So don't worry about the results. Just do what is needed to be done today, and tomorrow will be taken care of.
Sir, beautiful line.
Beautiful line.
Taking care of students. Don't think of tomorrow. Thank you, Didi, for such beautiful your answer. So now, you said that you don't get any chance to study during your internship. So I will not ask this question that one of my junior asked me that. Okay. So now I would like to shift to the next question that how to do the revision and handle such 19 huge syllabus, 19 subject of huge syllabus. Your revision
Okay.
strategy.
Revision strategy.
Mm, Look, the internship question, I would like to say that because I did not study in internship, that does not mean that somebody has the energy and if somebody has that determination to study during internship, definitely they can. Gynae, medicine, surgery, I think we all will agree that there will not be much time to study. So what one can do during those major postings is one can solve previous year questions. So you solve those previous year questions in your phone only. Now we have all those apps in our phone. So I would suggest doing that, previous year questions, and getting back to whatever topic you have done wrong, just glance through the explanation. You will not have time to study the notes then. So go through the explanations and then you're good to go. And when you are having minor postings, at that time you can maybe study those subjects which are going on, like community medicine যখন হবে তখন community medicine এর নোটসটা পড়ে নেওয়া, যখন psychiatry হবে তখন psychiatry নোটসটা পড়ে নেওয়া. Psychiatry notes you can easily complete in 1 week, right? So that is one thing that you can do. And coming back to your next question, 19 subjects revision, I would say that please make sure that you have gotten all your notes ready with you before you start your after and at the end of your internship you should have all the notes with you, all the 19 subjects that you have acquired over time. So whether it is printed notes or whether it is your own handwritten notes, make sure that you have it with you during the starting of your preparation. And then like I said, make a schedule, like say for the first revision, since you have to do it very well, so let's say you are going to do 2 subjects a week. So divide those. If you have 19 subjects, how much time you are going to take if you do 2 subjects a week? So like that you have to keep a timeline that first revision I'll complete all my 19 subjects in 2 months, 2 subjects a week I'm going to do, and make a schedule. Every day schedule should be there week wise, that this subject this many part, this subject this many part, and these many questions I'll do, and slowly and steadily you will complete those subjects. So let's say you don't do medicine and surgery together, because medicine, surgery, or medicine and OBGY, if you do it together, 2 major subjects together, you might not be able to complete, and then you'll feel like I'm not progressing. So rather, let's say take up a first year subject along with a third year subject. Let's say community medicine with pharmacology, or you do medicine if you're doing, then do anesthesia. Medicine, anesthesia, and psychiatry you can do together, like that.
So proper planning and execution of this planning is the key role in your handling the 19.
Definitely. And every person, the plan will differ. Not my plan might not coincide with my friend's plan, but that does not mean that it is not going to work for me. So individualized planning should be there, and then execution of that planning should be there.
Exactly. So last but not the least question, is actually it was asked on my batchmate, and same question also one of my junior, that it is really possible for a like mediocre student just like not getting an gold medal honors CA, it is really possible to crack them the INICET.
Yes, definitely. I mean, this should not even cross your mind that I'm a mediocre student or I'm a below average student. I mean, these are labels that we have put on ourselves which have absolutely no meaning. Because if yesterday I was not studying, if from today I start studying, I can definitely make it happen. And if I keep on doing that same thing for 1 year, I will definitely make it happen. It does not matter whether an honor student does it or an non-honor student does it, right? If suppose a gold medalist stops studying for 6 months, that person is not going to get a good rank. And if today a person who has not scored any honors starts studying for the next 6 months consistently every day, that person is going to get a good rank. Nobody is there to stop.
Thank you so much, Didi, for showing such our vision, so making so clear, because it was a huge number of the students that it is not our duty or our cup of tea of cracking the INICET, as we didn't get any such a decent marks in the prof. So I think your words will make them inspire.
No, professional examinations are very different as compared to your competitive examination. That is what you need to keep in mind. So do what is required for this examination and stop thinking about the previous examinations. That is what I would suggest. And thank you so much, Aditya, for inviting me also. It was a pleasure talking to you.
Thank you. Thank you, Didi. So I think we have at the all my questions have finished that I got from my seniors, juniors, and also batchmates. So Didi, thank you again, and it was a nice session, and your answer was really inspiring. So Didi, just say bye to our viewers, and to everyone. Just we have ended our season, and see you in the next video. And if you have
Bye-bye.
any questions. If you have
And
any
all the
questions,
best.
please, if you have any question, don't hesitate to comment below, and I will try to answer. And if possible, Didi will also answer. So see you in the next video. Bye.